Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Everyone, listen carefully. When your back hurts, do not treat it as a simple mechanical failure. Treat it as a message from a living system. Muscles, joints, nerves, sleep, stress, fear, habits, and time all speaking at once. Why does back pain disturb people so deeply? Because it attacks the center of movement. You feel it when you stand, sit, bend, cough, drive, pray, work, lift a child, or simply try to sleep. And when pain is in the back, the mind often asks one frightening question: is something seriously wrong with me? Now pause. Ask a better question. How should I respond? The answer is not panic. The answer is not lying still for days. The answer is not chasing every scan, every pill, every quick fix. The answer is disciplined recovery. Do not misunderstand the word discipline. I am not talking about punishing the body. I am talking about giving the body a plan and following it calmly. Discipline means move when fear says freeze, rest when pride says push, strengthen when comfort says avoid, seek help when warning signs appear. Repeat the small actions long enough for the nervous system to trust the body again. The World Health Organization's guidance on chronic low back pain emphasizes education, self-care strategies, exercise programs, certain physical therapies, and psychological approaches such as cognitive behavioral therapy. The American College of Physicians also places non-drug options: exercise, mindfulness-based stress reduction, yoga, Tai Chi, motor control exercise, multidisciplinary rehabilitation, and cognitive behavioral therapy. At the front of care for chronic low back pain. Why? Because back pain is often not solved by one dramatic intervention. It is usually improved by organized, repeated, intelligent behavior. First, command your fear before it commands your spine. Ask yourself, why does pain make people stop moving? Because the brain is protective. Pain is not only a signal from tissue, it is also a decision made by the nervous system about threat. If your brain believes bending is dangerous, it may tighten muscles before you even move. If you avoid movement long enough, the back can become weaker, stiffer, and more sensitive. Then the pain feels like proof that you were right to avoid movement. That is the trap. Break that loop. Do not tell the audience, ignore pain. Say this instead: respect pain, but do not worship it. How do you do that? Use graded exposure. Choose one movement that worries you: bending, walking, sitting, lifting. Make it smaller, make it safer, make it repeatable. If bending hurts, begin with a hip hinge to a high surface. If walking hurts, begin with 5 minutes. If sitting hurts, sit for 10 minutes, then stand for 2. Increase slowly. Teach the nervous system: this movement is not an emergency. Cochrane's review of exercise therapy for chronic low back pain included a very large body of trials and found that exercise probably improves pain and functional limitation compared with several conservative alternatives. The effect is not magic, but it is real enough to matter when repeated consistently. That detail matters. Exercise is not a single event. It is a dose, like medicine. Miss the dose long enough, and the effect fades. Second, stop making rest your main treatment. Why? Because the back was built for load, rhythm, and variation. Yes, severe pain may require short-term unloading. Yes, during an acute flare, you may need to reduce intensity, but do not convert a short pause into a lifestyle. Bed rest can feel logical. If movement hurts, I should stop moving. But biology does not always reward logic. Muscles lose confidence, joints stiffen, circulation slows, fear grows. Give this command clearly. Stay gently active. How? Walk. Change positions. Use heat if it helps. Breathe deeply. Do simple pelvic tilts, supported bridges, relaxed spinal rotations, or easy hip mobility, only within a tolerable range. Do not chase perfect posture all day. Chase position changes. The best posture is often the next posture. Cochrane evidence comparing bed rest with staying active in acute low back pain shows that advice to stay active gives small improvements in pain relief and everyday function compared with advice to rest in bed. That finding may look modest on paper, but in real life it can decide whether a person returns to normal movement or begins weeks of protective shrinking. Third, build a disciplined daily spine routine. Ask, how many people want relief but have no system? They stretch randomly when pain is high, stop when pain is low, and then wonder why the cycle returns. Do not do random rehabilitation. Create a minimum daily standard. Use this structure. 1. Walk daily. Start with what you can repeat tomorrow. If that is 6 minutes, do 6 minutes. If that is 20 minutes, do 20. Do not compete with yesterday's ego. Cooperate with today's body. 2. Train the hips and trunk. The back often suffers when the hips are stiff, the gluteal muscles are underused, and the trunk muscles lack endurance. Use controlled exercises, hip hinges, bridges, side planks modified at the knees, bird dogs, dead bugs, step-ups, gentle carries, and squats to a chair. Why these? Because they teach the spine to share work with the hips, ribs, abdomen, and legs. 3. Practice calm breathing. Put one hand on the lower ribs. Inhale quietly through the nose. Exhale slowly. Let the ribs move. Why? Because pain often comes with guarding. Guarding changes breathing. Changed breathing increases tension. Tension feeds pain. Break the chain. 4. Schedule movement snacks. Every 30 to 60 minutes, stand, walk, extend the hips, roll the shoulders, or perform 5 slow sit-to-stands. Do not wait for pain to remind you. Discipline means acting before the alarm becomes loud. The Lancet Low Back Pain series criticized the overuse of passive and low-value care, excess imaging, prolonged rest, opioids, injections, and surgery when not clearly indicated, and emphasized better education, activity, and active rehabilitation. Why is that important? Because the medical world has learned that doing more to the back is not always the same as helping the person. 4th, understand imaging without being ruled by it. Ask this: how many people become more afraid after seeing words like disc degeneration, bulge, or arthritis on a report? Many. But imaging findings and pain do not always match perfectly. Some people with dramatic scan findings feel little pain. Others with severe pain have scans that do not explain the whole story. So command yourself. Do not let an image become your identity. Does that mean scans are useless? No. Be precise. Imaging is vital when there are warning signs, new bowel or bladder problems, numbness in the saddle area, progressive leg weakness, fever with infection risk, cancer history, major trauma, unexplained weight loss, or severe symptoms that do not fit the usual pattern. If those appear, seek medical evaluation urgently. But if ordinary low back pain appears without those signs, many guidelines advise conservative care first rather than immediate MRI. Research on early MRI in acute low back pain shows that without signs of serious disease, early imaging is generally discouraged in the first weeks and may be linked with longer disability or higher downstream costs in some groups. Why? Because labels can change behavior. A person who thinks my spine is damaged may move less, fear more, and accept procedures they may not need. 5th, discipline your language. Do not say, my back is destroyed. Say, my back is sensitized and I am rebuilding tolerance. Do not say, I can't bend. Say, I am retraining bending. Do not say, I have a bad spine. Say, I have a spine that needs guidance. Why does language matter? Because the nervous system listens. Words are not just descriptions, they are instructions. If every sentence tells the brain danger is everywhere, the brain may increase protection. If your language becomes calmer and more accurate, your behavior usually becomes braver and more consistent. How do you practice this? Pair every pain statement with an action statement. My back is tight, so I will walk for 5 minutes. My back is sensitive today, so I will reduce the load, not cancel the plan. My pain rose after lifting, so I will review technique, sleep, stress, and dosage. Sixth, stop chasing intensity and start chasing consistency. Why do so many people fail rehabilitation? Because they treat a good day like permission to overdo everything. Then the next day hurts and they quit. Do not ride the boom and bust cycle. Use pacing. Here is the rule. Find your baseline, then build by small margins. If you can walk 10 minutes without a flare, do 10 minutes for several days. Then try 11 or 12. If you can lift a light object from a table, repeat that skill before lifting from the floor. If sitting 20 minutes is tolerable, practice 20, then 22. Progress should be boring enough to repeat. How do you know you are progressing? Track function, not just pain. Can you stand longer? Sleep better? Walk farther? Bend with less fear? Return to work tasks? Lift groceries? Play with your children? Pain numbers matter, but life capacity matters more. Seventh, train the mind as part of the back. Why does stress worsen back pain? Because stress changes muscle tone, sleep quality, inflammation signaling, attention, and pain sensitivity. The back may be the stage, but the whole person is in the play. This is why cognitive behavioral therapy, mindfulness-based approaches, and multidisciplinary rehabilitation appear in major guidelines. They do not mean the pain is imaginary. They mean pain is influenced by body and brain together. So give yourself these commands. Sleep on a schedule. Reduce doom scrolling about symptoms. Do not test painful movements every 10 minutes. Eat enough protein. Hydrate. Walk after long sitting. Build social support. Keep appointments. Ask for coaching when stuck. Systematic review evidence on cognitive behavioral approaches for chronic low back pain points toward benefits in areas such as pain coping, fear avoidance, and self-efficacy, especially when combined with active rehabilitation. How does that work? It helps people stop treating pain as a command to withdraw and start treating it as information to manage. Now, let us make the plan practical. For the next 7 days, do this. Day by day, walk at a tolerable dose. Do not negotiate with laziness and do not argue with severe pain. Adjust, then continue. Practice 3 controlled exercises, 1 for the trunk, 1 for the hips, 1 for the legs. Keep the effort moderate. Leave some strength in reserve. Set a timer during sitting work. Stand before the back begs you. Write 1 sentence each night. Today my back allowed me to do. Train attention toward capacity. Protect sleep. Why? Because a tired nervous system is a louder nervous system. And if red flags appear, do not be heroic. Get medical care. So what is the deeper lesson here? Back pain often tempts us toward extremes. One extreme says, do nothing, rest until life returns. The other says, force through everything. Pain is weakness. Reject both. Choose disciplined recovery. Why is discipline so powerful? Because the back trusts patterns. The nervous system trusts repetition. Muscles trust progressive load. Confidence trusts evidence. And life returns not through one grand gesture, but through hundreds of small, well-aimed decisions. How do you begin? Begin today. Stand up gently. Walk a little. Breathe slowly. Move with respect. Strengthen with patience. Speak to your body with authority and kindness. Keep going long enough for your back to learn that movement is safe again. Remember this. The goal is not to have a spine that never complains. The goal is to build a life where your back no longer controls the room. Take care of your spine, take care of each other, and I'll see you with the family in the next topic.